So first, I'm going to go ahead, after I've washed my hands, I've entered the room, I'm going to go ahead and introduce myself to the patient, and I'm going to go ahead and look at her head. I'm assessing for any facial symmetry as well as any abnormalities or deformities in the head. Her head, if you could turn it, is normocephalic as well as atraumatic. The next thing I'm going to do is I'm going to use my pen light, and it's going to shine this imaginary light into both eyes. Please look that way for me. So I'm going to go in one eye here and one eye here, and I am looking for a normal, brisk response. The pupils are perla. Pupils are equal, round, reactive to light, and they're also 3 millimeters. Go away for a minute, please. Thank you. Next, we are going to go ahead and examine the ears. I'm going to tell the patient to tilt her head this way, and I'm going to go ahead and examine the auricle, and I'm going to go ahead and lift the pinna up and back, and I'm going to go ahead and examine the outer ear for anything, but I'm going to go ahead and take my otoscope, and I am going to look inside, and the reason I'm pulling the pinna back is to straighten out the ear canal, and I'm going to look in, and I'm going to look for any of the landmarks. So the tympanic membranes are pearly gray, the cone of light and umba are present, and there is no impaction. I'm going to go ahead and have you turn the other way, and I'm going to inspect the auricle on this side, and I'm going to go ahead and look in. And in this case, we do see cerumen impaction, so that means that she has an impaction of earwax in her ear. I'm going to go ahead and let the patient know that will be removing it. So I saw in your ear that there was cerumen, which is earwax, and it is impacting your ear canal. I will be removing it with a curette after I finish the exam. Is that okay? Okay. Excellent. So after we've looked at the ears, I'm going to use my otoscope to look in the patient's nose. Go ahead and I'm going to go ahead and tilt the patient's head back, stick my otoscope in and look inside. I am examining the nasal mucosa, looking at the turbinates as well as any septal deviation, which there is none. The nostril is also patent. I'm going to go ahead and look in the other one. Okay, excellent. Next, after we've examined the nose, I'm going to go ahead and look in the patient's throat, mouth and throat. Go ahead and open, say ah. I'm going to go ahead and look at the mucosa. Look for the buccal mucosa, the tongue, hard palate, the gums, as well as the teeth. And I'm going to look at the tonsils and look at the grade of the tonsils. They're 2+, as well as the uvula. The mucosa appears normal. Next, I'm going to go ahead and look for any lymphadenopathy. I'm going to start with the parotid lymph nodes. Go to preauricular, go to postauricular, postauricular, occipital. Go down to posterior cervical, anterior cervical, as well as supraclavicular and infraclavicular. No lymphadenopathy is noted. Next, I'm going to go ahead and check the patient's thyroid. I'm going to come behind her. Go ahead and face the camera, and I'm going to look for any of the cartilaginous landmarks, and look to see if it is midline. Go ahead and swallow for me. Okay, great. And that is how we inspect the thyroid. Okay, great. And that concludes the exam. I'm going to go ahead, take my curette, and remove the impaction. Go ahead and okay, bang. Okay, the cerumen impaction has been removed. Thank you for watching.